guys. So today we're gonna start setting of the teeth, and we're gonna distribute for you guys like teeth set like what we have here. I'm gonna distribute to all of you. He has to has this teeth set, and we have to know that where is the anterior and posterior, where is the upper and lower, where is the position for each tooth. Okay. So these I think are mixed up for you now, and I think for the anterior and posterior it's easy to find, right? Okay, I can say that this is posterior and these are anterior. But where is the upper and where is the lower? You can see here also the upper and lower, it's easy for you to find, right? So I can tell this is the upper teeth and this is the lower teeth. But if we go to the posterior, maybe a little bit gonna be harder for the other, hard for some other people. Okay, so where is the upper and where is the lower? So this is the lower teeth and this is the upper teeth. Why you say that? Either you can find it out by morphology or the shape of the tooth, or there is other way you can find. There is on all pieces you're gonna find numbers and some like letters. راحت الأرقام والأحرف هنا vivident ivoclar numbers letters. Also this one. Always you have to put in the good, I mean that you can read them, like 20, 22, 0, D1. Here ivoclar vivident, then I can read them. Okay, so then if you can read them, you will see these teeth are come from down to up, means it's posterior lower teeth. If it's like this, you cannot read what's written there and this, right? So this is wrong way, so you have to put it like this, and then you will know this is the lower teeth. Also for the upper, like this. Okay, yes, I can read them. So these teeth come from up, and these gonna be upper teeth. Okay, واضح؟
واضح بس احنا ترى في الكاميرا يطلع تفهم بس الكونسيبت. ايه فهمنا الكونسيبت.
اوكي، واضح شباب؟ لانه بعد كذا انت راح تبدا setting for each tooth، وبعد كذا راح تكون في معك لخبطه، فلا تصير في معنا اللخبطه دي. ممكن some of you guys yes.
طيب لو suppose that you have a tooth and it's not in the set. How can you say this is
Morphology.
upper, lower, left, right?
Morphology.
From the morphology. And the left and right, you can check them from the morphology as well. So you have to depend on your second year information and knowledge, and then you can decide. Shukran, Salah.
Yeah, and let's say if I take out one single tooth from here, I'm gonna do setting for that tooth. Okay, I'll do setting for this tooth. If it's okay, I wanna make it later, so I have to take it back to its position in order that it will not mix up. يعني مثل قاعد تشتغل على تسوي setting for this tooth. So let's say you're gonna do it after a break or whatever, you would have to take back the tooth in its position in order that you will not mix up all the teeth. Okay? Okay, how about right and left? Let's say this is anterior teeth, and here is your articulator. You'll take the teeth set, just imagine it's gonna be like this. So if you'll take this canine, gonna be in the same side. The lateral gonna be to the same side. Also that's central gonna be in the same side. You got it? طيب. Also lower anterior, gonna be like this. You'll take the canine here, you'll set it here, down. You're gonna take this, let's make it small. You'll take this canine, gonna be here. Lateral, gonna be here. Center, gonna be here. So in the same side of the set. واضح؟ لا ندخل فيه الرايت والليفت للبيشنت حتى تكون معك ملخبطة شوي. Just to make it easy for a set itself, you're gonna put it in the same side. How about posterior teeth? Same thing. Let's say this side, which is my right, gonna be my right for the articulator also. Okay? This side gonna be here. واضح شباب؟ أكيد. اللي مو واضح ممكن أعيد حتى ما يلخبط السيتنج. أكيد واضح؟
واضح.
في ناس ساكتة والله ما تدري ايش عندها. أوكي. في أحد ممكن نعيد؟ أوكي. First of all, anterior and posterior, I think it's easy for you, right? Anterior and posterior teeth. You can tell these are anterior. قرب ماما شوف الشاشة. It's okay guys. These are anterior, you can tell, right? And these are posterior. To make sure if it's posterior, anterior, upper or left, upper or lower, all what you have to do, you're gonna find the numbers and letters. Put them in the way that you can read them. Like what we have here. I can read them, right? I have a clarivident here. So this teeth are coming from up, means upper teeth. So the neck is up and occlusal surface is down. So it's facing going down, means it's upper teeth. واضح؟ أكيد؟ Also for the lower posterior. I'll check the letters and numbers so I can read them. So the teeth are coming from down going up, means I can read what's there. And these teeth are coming from down going up, means it's posterior lower teeth. Regarding to the side of the teeth, so you're gonna follow the same idea. It means I'll take this teeth set, I'll put them to the articulator here. So this central gonna be in the same side here. This lateral gonna be here. This canine gonna be here. The same area, same side for the teeth, for the set. واضح? Also for the posterior, for the lower anterior. This side gonna be here, lateral, canine, to the same side of the teeth set. Posterior teeth, I'll divide them by 2, right and left. So this side gonna be here up, there, and the other side gonna be there. ممكن هم لخبطة شوي معكم.
لا
أكيد؟ Good. So let's start, guys, how to do sitting. Our reference here, or let's say our guide, is I think حسب الله book. First of all, I'm gonna do for you guys sitting for one side, means like what I have done here, will be one side, anterior and posterior, and for you guys you're gonna do for sure all of them, but in order to save your precious time. Okay? Let's have a look for the anterior guidelines. Look at the anterior sitting. The green line, it's give us what we call closer plane. Yeah. So the two centrals are touching to the closer plane, and if you can see, the long axis of the tooth is going a little bit distally. The lateral is a little bit up, and the cruise it's a little bit up like 0.5 millimeter, and the long axis is going distally. Canine too, but on touch in the crucial plane.
اقدر احددها عن طريق الكونتاكت اريا.
الكونتاكت اريا كيف؟
يعني مثلا اللاترال مع الكونتاكت اريا ينرفع شويه عن الهوريزونتال.
لا، في المورفولوجي تختلف، يعني انت هذه ممكن واضحه لك، لكن your guide is crucial plane. لأنه ممكن هاي square shape، ممكن يكون revolve، ممكن يكون roundish، ممكن يكون whatever. So your guide is the crucial plane. Okay, have a look for that's if you're gonna see it from facial side. And if you're gonna see it proximal side, you're gonna see the lateral, so let's start from the central. The central, if you can see, the neck is going a little bit in, and the incisor edge is out. فاهمين هذا الفيو اللي هنا؟ Okay, good. So lateral is also
more.
So the lateral is the more neck in, and the incisor edge is out, and canine is straight, or let's say it's perpendicular to the crucial plane. Okay?
الاوكلوجن بلين اليوم الدكتور قال لنا ما تقدر تحدده.
انت كنت موجود في المحاضرة؟ طيب.
كيف نحدده؟
كيف تحدده؟
الاوكلوجن بلين.
هنا ممكن يسهل لك القصة، اللي هو نفس هذه المكان. Have a look. This area which is contact in between upper and lower gonna gives you the crucial plane.
كان الدكتور قال
قال الدكتور كان
ايوه، انت في مرحلة يوم بدينا نشتغل على الواكس رم دائما كنا نتأكد من عندكم، نقول it has to be straight, has to be flat surface، صح ولا لا؟ And then also it has to be an occlusion and there is no space in between. حتى if you make it flat means it's gonna give you the same idea for like بقول لك شيء ممكن we can use like a flat surface like this, right? This is what doctor told you. Yeah, so this gonna help you also. But if you are sure from your wax ram, wax block gonna gives you the same advantage. Okay. So guys, have a look. هذه وين تصوير كذا احسن ولا كذا شباب؟ So first of all guys, so I have to take this. عشان اعرف I'll take the small amount which is enough for the central. Okay guys, you're gonna start, for me I'll do like upper right, upper left, right side, and lower right side. For you guys, you have to start full anterior, upper, and then you go for the lower anterior. Sorry? أيوة هذا I have to do. We have to make sure about something, that because we already started the sitting, we have to make sure about something. I'll tell it to you just wide. After wide. دائما تجي من هنا الكاميرا من هنا ايوه أكتر. we have something I have to let you to make sure that while you do sitting for the teeth you don't need to add much wax because all what you are doing now just setting of the teeth, just fixing the teeth in their position, because later on we have a step we call it either fastening or wax up, and we're gonna give the gingiva the natural shape. You can have a button everywhere. Here in this area you can see like it's curve. We have to continue this curve. You maybe guys maybe do it like this. You maybe do it like this. Or you do it like this.
Okay.
So it has to be curve like this. Also you can have a look from this side. This side. Here. The two neck are on the same level. And if you see this neck is going a little bit deep. صح? And these two necks are on the same level. So I have to go to the other one. And here this important thing is the start. Before I start from for the sitting, I have to have some guidelines, which is the midline, which is really important. Otherwise, you're gonna mix up the things and gonna repeat or you're sitting. So, and we all know, I think, at this stage, as third year students, and how we're gonna determine the midline. صح ولا لا؟ ولا ما فهمت ايش قلت؟ Okay, I need شوف واحد كذا حمام. ايه ركز مع الشاشة. على فكرة ما قاعد اسوي سيتنج، انا قاعد ادور واحدة بس الكل على الشاشة. هذا شو اسمه هذا اللي اعطيني؟ عبد العزيز ملحم؟ وين عبد العزيز؟ مريحم؟ مريحل. وين عبد العزيز مريحل؟ How to determine the midline يا عبد العزيز؟ ولا ما فهمت السؤال؟ ولا ما سمعت السؤال؟ ولا مو معنى؟ ولا أي شيء، قول شيء بس. عبد العزيز ارفع صوتك خلينا نسمع. سمعت السؤال أول شيء؟ فهمت السؤال وش المطلوب؟ طيب ليه نحتاج الميد لاين؟ Good. Here I have to compare the two sides. Two centrals are on the same level and I have to see it from here too. From this side. Okay? عبد العزيز ما سمعنا وش قلت الجواب. أنا سألت كم سؤال؟ واحد. سألت سؤالين؟ يلا جاوب اثنين. كويس سألت اثنين.
جاوب واحد.
الأول الميد لاين مع
النوز هذا if we are talking patient mouth ممكن gonna help you in the nose. لكن انت اليوم technician ما عنده نوز.
من نفرين نعم.
الله يزينك ساكت اللي قلت فرينا. ما كان السؤال عندك. سمعني يا انساسي بابيلا. انت؟ صح. So we're gonna find where the incisive papilla, and then we're gonna draw the line going out. نسولف نسوي ستك نفس الوقت. ما يمنع صح؟ if طبعا راح نرجع على الجايد لاينز لكن if we have let's say a play area which is not enough for the tooth means there is no enough space for the tooth what we're gonna do I think اللي حاضرين اللكشر المفروض عارفين هذا الشيء. احنا ما عندنا or let's say I'm gonna do setting for this posterior tooth. Okay, and I cannot do it in occlusion means there is no enough space. The teeth set it's okay. Size are okay. But there is no enough space for the posterior teeth, let's say one single tooth. خلينا من posterior tooth, anterior teeth. لحظة بس حبة شوي حتى.
الدكتور ما فهمت السؤال.
مو يمكن لا احنا نتكلم هذا التوث لا تجيب لي اي اشياء ثانية. هذا التوث وش نسوي له؟
صغرة.
اوكي نصغره. طيب كيف نصغره؟ يعني سوي مصطلحات احلى شوي. صغر سو So we have to do something we call a trimming. So the trimming, how it has to be. So we have to do a trimming for the record block or record base. فاهمين؟
يعني
أبدأ أسوي a trimming للrecord base, then I'll get enough space لأن the thickness of the record base it's almost 2 millimeter. صح ولا لا؟ So I'll take the advantage for this, then I'll start trimming the record base, and then there will be a space for me. Okay شباب؟
في الأرض ولا في الهاي؟
لا الانتروكلوجن حتى في العرض إذا كان ما في enough space you can proximal you can do a little bit of trim.
دكتور حتى بعد ما نسوي السيتنج في بعض التيث يعني نسوي لك ترمينج.
لحظة واحدة بس أنت يا شباب لاحظ أنه we have done from the upper anterior. For you guys you have to start upper anterior then lower anterior. The 6 front upper and 6 front lower. Then you go for posterior teeth. واضح؟ Okay? You should not proceed. Let's say you finish upper anterior, somebody has to tell you that you have to go to the posterior, lower anterior. Finish upper, you have to have like green line to proceed to the other group. Okay? Because otherwise you will make it very hard time for us to adjust for you. I have done from upper anterior, then I have to start
المحاضرة كنا أصعب بعد شهر.
لما صار مثلا
راح تبدأ السيتنج وتشوف كيف الوضع. Then you can determine if it's easy or hard. So في مين سوى ماركتنج اليوم؟ في أحد سوى ماركتنج؟ جاهز؟
لسه
ما حد بدأ.
سوي
هذا الواكس. It's really bad. إيه، لكن هذا الواكس أصلا الأصفر it's not good for this.
لسه سنة طويل. صحيح دكتور سوي ديمو
the precious time of the self-care.
There's something important we have to talk about because we start with the lower anterior.
Uphold your closer.
We have done already the upper anterior, right? So lower anterior, how it has to be. If you can see here, all are in the same level.
2 millimeter above
In order for ليه ترفع؟
Overbite.
الاوفر بايت اوكي. اسمع في واحد قال اوفر جيت، وش الاوفر جيت؟ فتحين صح. So horizontal overlapping we call it. هنا he call it horizontal overlapping, that's we call it overjet. وهنا overlapping. So all the anterior lower gonna be in the same level, and if you can see the long axis for two centrals are straight and the two laterals are going distally a little bit and canines more distally. And if you can see here, the proximal view is the centrals are, the neck is going in, incisor is edge out, and lateral is straight, and canine, it's the neck is going out. Okay? So then the closer plane, long axis. نتكلم long axis. يعني هنا
facial شوي.
البلو line هذا gives you the like perpendicular مع closer plane. Closer plane. ها؟ الcanine it's going out buccally, it's not lingually. الneck going out. Okay?
نتكلم عن
So you can see, I think, do you guys have this book?
Yes.
So please have it with you while you do sitting. Okay? Or otherwise you can take a photocopy for these 4 pages. Okay. If you can see always while I'm doing sitting, guys, the teeth set, or let's say the trial denture, it has to be on the articulator. I shouldn't take out the ركز يا كاميرا مان.
اوكي كده.
Okay يا باشا. Okay guys, so the teeth it has to be on the articulator at all the time. And some other thing is you have to keep what we call a causal plane, the incisal pin, we have to keep it always locked here. Otherwise, you'll have later on false relation while you do sitting. So it means it's not the same relation you got it from the patient now. Guys, have a look closely. All are in the same curve.
شوف النكهة الحين شلون تسوي.
النكهة هنا. Okay. So the next, you cannot see it clearly here, but you have seen it by your eyes, where you can easily determine. Let's say this is clear for you. This, the neck, you can see how it's in.
دي ولا دي في النص.
Sorry.
السنتر.
Look at to this canine. It's little bit out. You can see the neck that it's out, right? And all from a closer view is doing the same curve. And if you can see, I'll give you the relation, the advantage of guide. We draw something we call guidelines تتذكروها؟ عبد العزيز مو عبد العزيز، عبد الرزاق يتذكرها. وين عبد الرزاق؟
عبد الرزاق.
تتذكر جايد لاين صح؟ يوم رسمناها على الكاست قبل ما نبدا ايش عبد الرزاق؟ سوري؟ ما اسمع ترى. بالضبط. سو قبل لا نبدا الريكورد بيز وش سوينا؟ وي درو ذا جايد لاينز صح؟ جايد لاينز اتس هيلبس مي شنو؟
عشان نحطهم على الكريست
It's gonna help me to do the wax ram صح؟ So the wax ram now it's my guide also for what?
كريست
For the teeth, to do a teeth set صح؟ So now we got the relation which is there underneath up. فاهمين السيكونس؟ والله شكله ما في أحد. أكيد؟
بس سؤال مرة ثانية دكتور.
نعيدها مو مشكلة. نعيدها 1000 مرة بس لا أحد يقول مو فاهم وهو. سمعنا السؤال أول ولا نقول لك وش هذا السيكونس أول؟
سؤال
لحظة. So تتذكر يا الجايد لاينز تتذكرها؟ طيب. بعد الجايد لاينز وش سوينا احنا؟ بدينا الواكس رام صح؟ الواكس رام كان في لي جايد للواكس رام وش هو؟ ليه جايد نيز صح؟ that it's out or in. بعد كذا راح نبدأ setting على شنو؟ على الواكس رام. So الواكس رام it's got the relation from the guidelines. The wax ram it gives you the correct position for the teeth. Means how you go this sequence. Guidelines, wax ram, teeth set. واضحة؟ أكيد عادي ترى ما عندنا شيء هنا. بس sitting. في واحد قاعد بيسأل سؤال قبل شوي. نسيت.
لا ما نسيت اللي هو
Have a look. يلا سمعنا.
نفس الواكس عريض فممكن وانا احط شوي اقدم الفلوس قدام شوي ارجع ورا فما يجي على الفريم.
ما فهمت.
يعني احس ان الواكس مو بدقيق انه هو شوي الوجه حقه ممكن انا احطه قدام.
لا you have to take all the wax. You need just the wax which is underneath to fix the tooth itself.
ما يدري
احنا المفروض حددناه الخطوه اللي قبل.
المفروض من قبل يقول
يعني
مو بدقيق
the
مثل
tooth itself has to be in or out according to the wax this one.
لا
على حسب
حسين.
الجايد.
يقول هو مو بدقيق مثل الجايد لاينز اللي كان على طول على الكريست في درجه عرفت شلون؟ فذا
That
عليه.
this has to be either in the middle. صح؟ It has to be in the middle of the crest of the ridge.
في نص الواكس.
لا
شغلات.
حامي. Okay guys, Then you can see here overlapping and overjet will overlap. You can see it?
No.
Come on, man. صح؟
كم تقريبا
3 من 2.5 إلى 3
5 ملي نسويها، ايش رايك؟
من 3 من
No, it's too
2.5
much. 3 milli is too much.
2
2, 1.5, 2, 2. Okay, guys? You see it? Okay. And you can see it here that overjet. You can take out little bit, up this one little bit to make sure that there is overjet. Then حتى نستفيد من الوقت. Then we start posterior. Posterior teeth. Let's go for a guide.
لكن ما راح نقف بعد كل شيء ما
So we have to continue. It's not up to you guys.
لا عاد يكتبون.
Sometimes we give you chance.
هم لسه ما عملوش الماونتنج عقبال ما يوصلوا في السي سي
Because next week there will be no sessions.
اوكي النهارده بس يا دوب يعملوا ماونتنج ويحاولوا كده لان عقبال ما يعملوا ماونتنج ويعملوا انتير تيث هيكونوا ناس اصلا
Are gonna do at least 2 premolars and I'll stop. Okay.
اللي رايحك يا استاذ حسين نتابع.
Okay, guys, have a look for the posterior teeth how it has to be. Our guide for posterior teeth is only the upper. Okay. Upper premolar, first premolar here. Have a look here. Have a look here. Upper premolar. First one, the palatal cusp is touching to the occlusal plane, and also the second premolar. So the buccal cusp, it's away 0.5 millimeter, 0.5 millimeter, and first molar mesopalatal cusp is touching, and the others away 0.5 millimeter, and the second premolar is all away. راح يكون الميزيو باكال كاسب 1 ملم 1.5 for ميزيو distal cusp.
بس في المحاضرة السكند بريمولر تو كاسب تاتشز البلين.
لا كانوا متعكسين الاول بلتل والثاني اللي نقول
واحد
بلاتل.
اثنينهم بلاتل صح؟
لا اثنينهم بلاتل.
لا واحد
اول بلاتل والثاني
واحد بلتل واحد باك بلتل.
So let's go for this. Let's go for this. What we have here in this book, okay? For the sitting. But for the quiz, for sure you have to follow the lectures. Okay, guys? This is gonna be really easy.
في فايدة نسمي الوقت نروح نشيله.
Relation.
لاحق الريليشن
عفا. We forgot the advantage for this. قلت لك تعبت فيه كثير اساس كذا قاعد
ليش
يقول ليه اسوي هذا الشيء.
تعبنا احنا نسوي له بالبوليشنج في الجراب.
طيب ليش نشيل بيس باي بيس يعني ليش ما نشيله كامل ونسوي سيتنج مرات؟
كيف؟ ايوه we have to save relation at all time. لك
هذا فيرست بريمر دكتور.
ايوه first primo.
طيب الحين راح which cusp will touch the brain?
Sorry?
Which cusp will touch the occlusal plane?
The palatal
The
cusp.
palatal cusp.
طبقة واحدة نفس اللون. بلاتل يكون
think ايميل الميديا اللي حسين.
لا it has to be straight.
نسوي له انكلاين
Have a look guys. Stop.
سكند مولر بعدين سكند بريمولر بعدين بريمولر.
هلا هلا.
بس الحين تاخذ في الاعتبار الكلاينيشن كلها اللي درسناه في المحاضره اليوم يعني قال لك واجد. وكم حسابات يعني قال لنا.
منو؟ ايوه.
فانت الحين ماخذينها بالاعتبار.
يعني تحسها ايش يعني ما فهمت.
يعني يقول لك انك انت تشوفه بس بالعين كذا كويس خلاص.
صح انا هذا اللي اسوي.
يعني احنا بعد نسوي كذا.
انت عشان
سوي مثل كذا اكيد راح.
اذا ضبطت تقدر تضبطها زي سوي كذا.
اكيد يعني اتوقع انها راح تضبط يعني. راح تسوي الانتيريور بوستيريور طبعا.
بداية الخير.
For you guys, always you ask for these questions, and why it's easy for us and it's very hard for you. For sure, this is your first time to do such a thing. For us, we do it like our basis for daily basis things.
Daily.
Huh?
صلى على النبي صلى على النبي.
سلستين
نقول
تشوف
جيب
وايد.
أحسن، yeah. So guys, posterior teeth as what I have done, like these two premolars, I have to follow the instruction or what I have in the book. Then that's upper. Lower, all what we have to do is we'll put them in occlusion. Means مشكلة قفلنا. As what your colleague says.
ضامن جيد ضامن.
Okay? Gonna be like this. You see? So all what has to be all on the wax. واضح؟ وبعد كذا هذا هنا راح يكون the second one. So the lower posterior teeth, it's all in occlusion. So you have to take your time for the upper to make it perfect, and then the lower gonna be very easy for you.
So we should
Okay.
start with the upper ear.
We have to start with the upper posterior teeth before we proceed to the lower. Okay, and I prefer for you guys to start one side, I mean posterior upper right, let's say, and then posterior lower right, from the same side. Then you go to the other side. Is it clear for you guys? Easy.
سؤال بس.
Good luck.
لا الرمات حقت الوقت اللي نشيلها هنا.
الجايد لاينز بس.
ايوه.
هذا الشباب حاجه مهمه
Guidelines.
جدا تعرفوها بس ثواني. مهم جدا. تعرفوا هتشتغلوا ازاي. اتش ستيبس اند جايد لاينز.
كيف نرسم الجايد لاينز؟
لازم تعرف ازاي لازم اشتغل عليه.
في قلم.
Guys, you remember we just asked how to determine the midline, right? So the midline is, it doesn't come from this. This is what we call this one. Frenum. We have to find where this the incisive papilla is. Then you draw line going out. Almost the same for this case, but other cases is not. So then you have to draw to make a mark like this to make sure this is your midline
ونفسه يكون على المندبل.
going down to the mandibular.
كيف نحدد مكان الكينان؟ لان اليوم اخذنا كينان.
الحين بيشتغل.
طيب كيف حددتوا اليوم؟
اليوم سوينا
البابلة.
لا
لا لا.
حددناه بالكريست.
واحد.
يمكن حددناه بالكريست حق الانتيريور.
اي انتيريور سوينا عليه لاين.
طيب هذه كريست كلها كريست هذه.
اي كذا. ستريت لاين. ستريت لاين.
ستريت لاين.
ستريت لاين. بعدين ننزل تحت هذا المكان.
The highest. I'll tell you something. Wait. احنا حبة حتى نركز شوي.
كذا يا شباب الله يرضى عليكم الموضوع ده مهم.
طيب بعد ما رسمنا we draw the midline, we have to go down there. The same line. So and from this you have to start your central. Let's say your left central and then right central. Left lateral right, left, lateral, canine to canine. Okay. First of all, is the most important line is the midline. Guidelines for a canine, it's me sometimes not doesn't come perfect as it is because different size of the tooth, of the teeth set, but it gives you an idea that there is a curvature like this. You see how I draw this one? The crest of the ridge, then there is like angle here going out. أيوة. Angle here. All what I have done is drawing the crest of the ridge. حتى توضح لك how the crest of the ridge, how the shape of the jaw. crest of the ridge ترسمها.
تمشي على
الكريست الدرجة عن شلون اختفى
الزاوية.
ونفس الخط نفس الكروس.
يعني اذا حطيت سنتر او ليترال بيجي معك كنان ولا
إيه. حتى بدون guidelines. لكن for you guys you have to draw the guidelines. Okay. Okay guys.
اوكي نفس الشيء نسوي في المندوب.
ثانك يو حسين.
And then you have to draw a line here. Going down.
كنان.
حلو.
كناين هير ستريت في اسلوب
خلاص؟
في اسلوب ولا
شوي لا اسلوب راح يكون.
طيب امام
اي سؤال اي سؤال